The OCTA Research Group has noted an uptick in COVID-19 cases in Metro Manila as of late. Let's discuss this further with Professor Guido David, who joins us over the phone. Good afternoon, Professor Guido. What is the current infection rate in the capital, and when was the last time we saw it at this level?
Yes, hi, Sean. Good afternoon. Currently, the reproduction number, which is an indicator for the rate of infection in NCR, it's about 1.06. That means it has risen above 1. And the last time it was greater than 1 was back in April when we were still in ECQ. I think it was around April, yeah. So yeah.
Okay, so having said that, we last saw above 1 in April when we were in ECQ. Do you think it's about time we go back to imposing stricter lockdowns? Should Metro Manila go back to ECQ, basically?
Well, I think it's too early to make that determination at this moment because it has only been maybe a day that we have seen it. So we will monitor the situation closely and we'll look at the trends. And if the numbers continue to increase, because right now we're averaging 700 cases per day, and the last time we were above 700 was about 4 weeks ago. So since 4 weeks ago, we've been averaging less than 700, around 650, and last week around 640 cases per day. So if the numbers continue to escalate, then definitely we will be very concerned, especially with the news that there are local cases of the Delta variant even in Metro Manila.
Right, let's get to Delta in just a bit. For now, I want to ask you what you think drove this uptick in cases. Is it the increased mobility due to eased lockdowns?
Actually, it's very difficult to answer that specifically right now, Sean. So it might be the increased mobility. That's a possibility. Some people might think it's the Delta variant, although we're not seeing it yet. But we can't rule that out completely. But most likely, it's the increased mobility among people.
Right. So I'm going to go ahead and ask you, what other measures the government should impose in the face of, or the threat of the Delta COVID variant is very much upon us, so to speak? Yeah,
well, definitely one thing we could think about is rolling back the plan to allow 5-year-olds and above to go out. We're not specifically saying we should change that, but at least maybe we can reduce the time. For example, we could have them not being able to go out every day, but perhaps maybe 2 days a week or 3 days a week. So at least we can reduce the time spent outdoors, and also we could consider maybe increasing restrictions just a little bit, reducing capacities in establishments. So these are some of the things that we can discuss. We're not talking about ECQ, of course. We're talking about GCQ, but perhaps with some restrictions. These can be scaled back because of the threat of the Delta variant. We don't know when it will, spread in the region, and that's why we have to be prepared. Another thing that was discussed was, imposing a bubble around NCR plus. I think it has been thrown around that idea has been thrown about, but I'm not sure if the Department of Health was. I think they were not so keen on that specific idea.
All right. Over the last couple of weeks, we've also seen a lot of vaccines arrive here in the Philippines, a lot of supply now. Do you think that given our current pace of vaccination, which has improved in the past week, that we will be able to achieve our target of population protection by the end of the year?
Yeah, I think we should be able to do that, Sean. And specifically, we're also looking at getting to at least about 20% fully vaccinated. And we're actually close to that in the NCR. We hope that they can continue to prioritize the NCR. Doesn't mean that all the vaccines have to be given to the NCR, but at least give priority, especially with the threat of the Delta variant, because if a surge happens in the NCR, I mean, it will really affect the economy, affect everyone, and that's why having this bit of protection for our people in the NCR will be a great help in mitigating the spread of the Delta variant.
Right, so most of our confirmed Delta cases are actually outside Metro Manila, mostly in Region 6 and Region 10. Can you tell us, Guido, which areas outside the Metro are also seeing an uptick in COVID-19 cases? And what are the recommendations that you have for them?
Right, and let's remember that the genome sequencing is a little delayed, so that means when they find cases in Region 6 and Region 10, we're talking about cases that were there about 4 weeks ago or maybe even longer. What that means is we don't know the current situation right now, but what we're seeing is that we did have a surge in Region 6 and in Region 10 several weeks ago, but now the number of cases have subsided in these regions. And right now what we're seeing are Ilocos, specifically in Lawag, it's having a surge. We're still seeing high numbers in Mariveles, in Bataan, and then in Central Visayas, we're also seeing a spike in cases. So these are the areas that we're focused on right now. So, Davao City still has the most number of cases, but the trend has slowed down there. Same thing with Iloilo City and Bacolod and Cagayan de Oro. So we're still seeing high numbers in these areas in Mindanao and Visayas, but right now the current hotspots we would say are in these areas, like I mentioned. But we're also seeing a spike, as we mentioned, in Metro Manila, specifically in Makati and Manila. So cases increased quite a bit. Not very high increase, but a noticeable increase in cases, and that includes also Valenzuela and I believe a few other LGs in NCR.
All right, thank you so much for sharing the numbers with us and breaking them down. That was OCTA Research Fellow Professor Guido David over the phone. Thank you.